our main goals were really to build a comprehensive and up-to-date global synthesis of the data available, to really understand what was causing AMR, the selected bacteria and the resistance that we saw. To then use that data to understand the prevalence of resistance over time and space. So to perform the geospatial mapping. And then, as well as estimating the burden of AMR, bring that into the global burden of disease study. And why global burden of disease study? Well, it's a systematic scientific effort to really quantify the health loss due to different diseases, injuries, and risk factors, and then look at that by sex and by age groups in specific years. Ideally, we would like to have a database that has a line for each patient in that database, which means that we can really understand that data. And that would be having clinical data on a patient, having the microbiology data, and the outcome data, whether the patient lived or died. This really gives us rich information to understand what's happening. And also, because it's big data, it means that we can see connections between that data that we wouldn't have been able to see before. What we see in practice is that the data is siloed. So often you have microbiology data in one database, hospital and clinical data in a different database, mortality separate, and then surveillance data separate again. There have been many initiatives, certainly over the pandemic period, where these databases are starting to be linked up. And I think it would be fantastic if we could really make the most of that and bring that into the AMR world. We do have our first estimates, and we need to use this data, this evidence, to really move into action. We need to have a continuous quality improvement. We know that the data that we have in the GRAND project is probably the tip of the iceberg, and that there's much more data available, but we need more collaboration to make that data available. It's difficult to understand that data without the data management, the analysis, and the interpretation. So all of those need to be improved in many, many different countries. And we've been working very closely with lower and middle income countries to try to build this capacity if possible.
We have seen from Pew Charitable Trust in their analysis of the current antibiotics pipeline that was released in April of this year, that there are currently only 43 antibiotics in clinical development. Many of these are still in phase 1 or phase 2. What that means is they're still 5-10 years from being into a patient, even if they are successful. Of these 43, only 15 of them are really addressing the critical pathogens. So we as industry need to do more. Certainly, we focus in on research and development, the need for new business models, committing to supporting new research and development. However, that is just one piece of the puzzle, and it's one piece of the puzzle that industry can take on. Other areas that industry needs to and has to support, and which we at Pfizer do, focus on vaccines. What is the role of vaccines as prevention of the infections so that the patients don't even need to get antibiotics? Stewardship is absolutely critical about what and how industry can support and ensure the appropriate use of the medicines that the community has. We initiated conversations with the Wellcome Trust and established the SPIDER partnership with the goal of creating a scalable surveillance platform that's supported by a robust public-private partnership. And this is absolutely critical to expand AMR resistance data, strengthen public health capacity, and most importantly, improve patient outcomes in low and middle income countries. We initially focusing this work on 4 countries in Africa: Ghana, Kenya, Malawi, and Uganda. So what can we achieve together, and why is collaboration important? Certainly improving data and the infrastructure in the regions with limited capacity and surveillance capacity provides systematic data that informs appropriate use of antimicrobials and helps drive policy reforms, improving access to data, developing a uniform surveillance protocol that integrates clinical, laboratory, and demographic data, establishing a framework that demonstrates the value proposition of partnerships, creating a platform that's scalable and can be augmented. But most importantly, it's about improving the outcomes for the patients. And I think we always have to bear in mind that when we're talking about anything around antimicrobial resistance, we're talking about what this means to the patient. We all can support collaboration by building greater trust, being more clear about our intentions, seeing partnerships and not silos, through greater transparency and seeking out the yes and avoiding the no's. Through all of these key points, I think will enable the industry to work more and work better and more constructively with government partners, with academic partners, and with other funding organizations. And think about how we can improve the way in which we work together so that we're meeting the needs of the patient.
How have you actually managed to create the trust and transparency that's really essential for an effective partnership?
It starts with transparency. It starts with being very upfront and honest with your potential partners about what you're doing and why you're trying to do it. Each partner doesn't necessarily have to have the exact same desired outcome. Those desired outcomes and goals need to be aligned. And as long as they're aligned, there's opportunity to then say, okay, we have a set of aligned objectives here. Let's commit to working harder and working better, because through collective action, it's more effective and more efficient, and you'll have better outcomes because we can leverage each of our areas of expertise.
So if I think about what worked first, it can be quite a long process. So building the trust works, working together with that collaborator, understanding their problems prior to engaging with them. And I think that there's a buy-in. People want to have AMR comparable to other diseases. So there's a real, want to share that data to see what it looks like in their country as well, to make it local for them. And I think because policymakers will use this data locally, I think all of those are drivers to share the data.
One of the key components of this is ensuring that the local community has the ability to perform the analyses themselves and do the research themselves to support the data for action.
Data generation is one thing, but we actually need to see that data being used. And one of the gaps that we see is the ability to actually analyse and the availability of tools to do that. So I think for the SPIDAR project, Wellcome is definitely stepping in to provide some training there, and also to help both on the research capacity side, but also on the policy capacity side there. So the policymakers can actually look at this and understand what they're seeing and what they need to do with it.
I think we absolutely need to be thinking about ways in which we within industry and in partnership with governments can sustainably support long-term research and development to bring the antibiotics of need to the patient community. A new commercial model is needed. Certainly, I think government policymakers need to do that as well. But in our recognition within industry, we can't walk away from a commitment to stewardship and appropriate use. They need to be integrated and embedded together. Any conversation about access, research, and development needs to be linked to stewardship. And I think it's critical. Transparency comes from awareness, right? And being honest and upfront about what the data are. So I think first and foremost, we need to be transparent and honest through our awareness campaigns about what the risks are with AMR. There's only so much you can effectively communicate to the general public. So I think general awareness campaigns are a little bit different than a more focused advocacy campaign with government officials or public health officials. But I think certainly through awareness, you share information, you share data, and by sharing information, it only goes to expand transparency.
One of the first pillars within the Global Action Plan was actually awareness of AMR. I don't know that we're there yet in many countries. I think we're still at the point of trying to make more people aware. the healthcare sector, yes, but reaching out from there. And I think it starts there. Have those conversations, have people understand what it is.
Yeah, and is there a role there for translating some of the fantastic research that we already have available, translating it more effectively into those messages that can then be understood more easily?
There's some fantastic social science work in this area, and we just need to integrate that a bit more with the data. And that's, I think, how we would move forward for action, really.
And I think we as a community need to do a better job with engaging with the broader patient community to expand their understanding about the role antibiotics play in supporting improved outcomes for their patients.
Data and evidence generation is crucial to underpinning context-specific action, but it does require effective translation into intervention and policy to be of value, and collaboration can be a key role in that translation. We do need to focus on collaborating across sectors, both public and private, and thinking who's going to be using the outputs and involving them in the partnership. So whether that be Ministry of Health or patients, they have a very key voice and should be at the table from the beginning.